This Medicare season can be the most chaotic yet. Millions of seniors are losing their health plans. Benefits are changing and costs are shifting. If you're not paying attention, you could lose your coverage, your doctor, or even your food card benefits. My name is Melissa D. Hall. Welcome to Get Well with Mel. And today we are going to explore Medicare chaos. Thank you. Thank you all for tuning in. You all, for those of you all who may not be aware, I own a Medicare insurance agency in addition to being a talk show host. I have been helping seniors since 2017 with Medicare and since 2008 with life insurance. I have spoken on the biggest stages in my agency where I employ agents all across the country. We have been able to help over 3,000 seniors with their Medicare benefits. So I like to say I know a thing or two about Medicare and how the system works, which is why I am so concerned and had to do this episode today. As you all come in, please feel free to ask questions. I will be checking the comments. Please feel free to share this out with someone. And speaking of share this out, before I jump into everything, I have to go ahead and share this with my Facebook family and also my YouTube family as well. And if you are new to my channel, if you are new to this show, I go live every Thursday at 5:30. And as you watch, just say hello to me in the comments. I will be taking questions. And just to let you all know, all right. Hello there, Chris. How are you? I see you there. Chris is a big time supporter of the show out of Maryland. We definitely appreciate you. Thank you so much. And as you all come in, just say hello. I know I have my followers on my text list there. They are now getting the message to come in. Hello, Emily. How are you, Emily? Thank you so much for tuning in. Now we're getting into Medicare chaos, you all. So let me just give you a backstory about Medicare and what is actually going on right now. First things first, Medicare has two plans, Part A and Part B. Part A covers your hospital, Part B covers your doctor's visits at 80%. And you have to figure out how to cover the 20%. That is why the government contracted uh, private companies such as Aetna, Humana, United Healthcare, Anthem, uh, HealthSpring, and a plethora of other insurance companies all across the US to bring you something called Medicare Advantage or Part C. All right. If you have ever heard of Medicare Advantage or Part C, please let me know in the comments. Okay. So they're designed to help Medicare beneficiaries figure out how to pay that 20% out of pocket for their health costs because 20% is very significant. All right. Some people may think, oh, well, 20% isn't a lot of money. It could be. The average hospital stay is $50,000. To have a heart attack, the average cost of that is $1 million, you all. To have a heart attack is $1 million. Can you believe that? And multiple people a day are having them. So imagine having to pay 20% of them. It's a big problem. And most people on fixed incomes are getting less than $33,000 a year. Medical costs are the number one reason for bankruptcy for older adults. So, of course, something had to be done, and that is why they created the Medicare Advantage system. Currently, there's over 68 million people on Medicare. In 2025, this year, which is the crest of the baby boomers, okay, 12,500 people a day turn 65 and that are on Medicare that are using the system. The United States' biggest spending is in healthcare. All right. So, are you all getting the magnitude of this problem? And currently, there are 35.5 million people that are utilizing the Medicare Advantage system, okay, that are enrolled in these plans. So when something changes, when people can't get access, when plans pull out, right, of states, of counties, no longer working with medical systems, right? It is chaotic. It is chaotic because it's a lot of people who are affected and will be affected. I really want you all to get this that the baby boomers, all right, and when we consider a baby boomer, we're talking about people 65 and older. They are the largest population in the United States. Over 20% of people are 65 and older. So this is a pretty big deal, okay? Are you all understanding the gravity of this in the comments? Emily, she says yes. Thomas says, I'm doing well. Very good. I'm very good. Very good. So I'm loving this. You all are getting it. So every year we have what we call the Medicare annual enrollment period. It starts October 15th through December 7th. That is when these Medicare beneficiaries can change their plans and new ones are updated. Okay. Throughout the year, they really don't have a whole lot of opportunities to change a plan or make any options. So this right now, this is the time. Right now, in October 1st through 14th, is what we call pre-AEP, meaning that beneficiaries can talk to us, can talk to a person like myself and get information, but they cannot enroll to kind of help them get a head start on deciding a choice. All righty. And I'm going to tell you with the new laws that I'm going to talk about and changes here, the insurance carriers have been kind of slow on giving us information, which I'll get into. All right. So a lot of things as agents when it comes to advising our clients, we are really just getting abreast on. All righty. And if you're out there and you are on Medicare or you have a loved one who's on Medicare, please feel free to reach out to me by going to www.thehallinsurancegroup.com. Or you can even go to my website listed here, and I would be more than happy to take it. Okay, so let's carry on. So let's talk about disruptions. What seniors need to know to stay calm. We have over 10 million people in the US who are currently on a Medicare Advantage plan that will not be renewing next year. Over 10 million people throughout the US. This is a big deal. States that are affected, Maryland. So if anybody here knows anyone in Maryland, all right, you need to share this with them. It is a good chance that their Medicare Advantage plan will not be renewing this year. I'm not going to say any names on any plan specifics that aren't renewing. Please contact me for that. But if you know someone in Maryland who's on Medicare, Vermont, okay, Vermont, millions of people in Vermont are losing their coverage. And it's just happening all across the US in pockets, in pockets. See, every Medicare beneficiary has to receive something called an ANOC letter, annual notice of change, that is mailed to them. Some have elected to have it emailed to them. If you haven't received this paper as a Medicare beneficiary, you need to reach out because this right here could be the only signal that you could receive that you will no longer have coverage from January 1st, 2026. Now, before I get into uh, the specific causes, right? The laws that have been changed to affect people being covered and these plans being exited. And I want to tell you two things. Number one, when it comes to Medicare Advantage plans, they change per county, right? So let's just say you live in Maryland and you live in Baltimore County. Y- And I will say this, Baltimore, if anyone from Baltimore is hearing this, you all are being hit very hard this year. Please make sure you check your mail for your ANOC. So with that in mind, these plans change by county, okay? These plans change by county. It is not that, oh, it's going to happen statewide. Plans can leave by county. Benefits are different per county, okay? So that is number one. So everybody could be different. So what happens to a person in Baltimore City is not the same as to what is going to happen to a person in Montgomery County, okay? The second important thing as I talk about these Medicare Advantage companies is their spending. Because I know that it is a notion and out there that insurance companies make all this money and they don't pay claims. Has anybody ever heard that before? And I'm going to say that in some scale, that isn't true. But however, in order for a company to participate in Medicare Advantage program from the government, there's something called the medical loss ratio that they have to meet. What that means is they have to spend a certain amount, which is currently 85% of all premiums paid, right, of all revenue on paying claims. Right. So meaning they're only making 15% profit, right? And actually it's not even profit. With that 15%, they have to pay administrative costs, have to pay their staff, have to pay for office supplies, they have to pay for if they have any real estate, building rentals, and all the other expenses that come with running a business. Listen, even their own staff's health insurance. So when it comes to this whole Medicare Advantage and Medicare spending and things, it isn't as if these companies are making a ton of money and wasting a ton of money on things that are just frivolous to live a lavish uh, existence. That is not this when it comes to Medicare Advantage. Now, the other insurance I can't speak to, but with Medicare Advantage, this is not that. Now, I see Thomas Clark. He he sent a message. Let me see what you said, Thomas Clark. He said this will be life changing for families who are already struggling to pay for groceries, pay a monthly mortgage payment, utilities, and other recurring bills. That is very true, Thomas Clark. That is very true. All right, so let's get into it. Who's to blame, right? Don't you all want to get into this? Who's to blame? Well, I always say I am for seniors. I am not for party. Okay, I'm for seniors, I'm not for party. And I know a lot of people looking at this will want to blame everything on Donald Trump, right? Let's just call it what it is. But this started with something called the Inflation Reduction Act. Who has ever heard of that? The Inflation Reduction Act was a law put into motion by the Biden administration. It had a lot of provisions, a lot of goals, but one of the goals was to tame out-of-pocket costs, especially for drugs for Medicare beneficiaries. It capped out-of-pocket costs for drugs at $2,100, right? So that's the most now anybody would spend. Now, mind you, this went into effect in 2024, okay? This went into effect in 2024. It also capped insulin at $35, okay? And on top of that, it also ended the donut hole, which is amazing, right? That's amazing. I cannot tell you how many times I have spoken to my clients who have really had to make hard decisions between purchasing their insulin, purchasing their heart medications, right? And paying their rent, having to cut pills in half. So this is amazing. However, keep in mind, we still have what we call the medical loss ratio, where these companies are only making 15%, right, of premium payments. And that's even before they pay their staff and all the other things, because these insurance companies are massive, okay? So let's talk about that. So with the Inflation Reduction Act, somebody had to pay for this. Somebody had to pay for a Medicare beneficiary having to pay less. And the government made the insurance companies pay. Let me give you an example. Part D plans, right? The Aetnas, the Humanas, anybody providing drug coverage to seniors. They used to have a 20% cost share. Now their cost share is 60% with the Inflation Reduction Act. Medicare itself, the government was paying 80% of the cost when a person got into the catastrophic stage. That, with the Inflation Reduction Act, went down to 20%. So do you see here how the government shifted the cost sharing? All right. And the drug manufacturer, they were paying 70% of the cost at one point, and they increased it to 80%. All righty. So when you having to pay more and you're already making a very small margin, things had to change for these companies to stay in business. And they did, which leads to number one, insurance carriers getting out of less profitable counties, right? They're getting out of less profitable counties. Less profitable counties are counties where people are just using their insurance, okay? Uh where they're using insurance, they're going to the doctors. You know, they might have something in that county, right? That makes people sicker. Let me give you an example. Let's talk about Greensboro, North Carolina. North Carolina is one of the most expensive states to insure. And in Greensboro, North Carolina, it happens to have the highest rate per capita for people with asthma. Okay. So what does that mean? Asthma is very expensive to treat. Inhalers are very expensive. Asthma can be a lifelong illness. Constant, if not managed, constant trips to the doctor and the hospital hospitalizations. That's very expensive, but that per capita rate and that occurrence is very native. So what would an insurance company do in Greensboro, especially if they have to pay more out? They leave. And that's what we're seeing happening all across Baltimore, for example. Baltimore, we all know, for those who know, okay, that Baltimore has a really big drug crisis here. And a lot of people get on Medicare there from being on disability. So you can get on Medicare three ways. You can get on Medicare, number one, from turning 65 and working at least 40 quarters, which is 10 years, paying taxes. Okay. Number two, you can get on Medicare from having kidney failure, okay, also called end-stage renal disease, and having to do dialysis. And the third way that you get on Medicare is for being on disability for at least 2 years. That gets you on Medicare as well. So imagine if you're at a place like Baltimore that has this drug crisis, that people are getting on Medicare in their 30s, they're living until their 90s, and the company has to take care of them, right? The insurance company has to take care of them the whole time. That leads to a crisis, okay? So another thing that we're seeing the insurance companies do to respond to this is that they are raising out-of-pocket maximums by thousands, okay? I've seen plans, let's say back in 2023, where the most a client would pay out of pocket, meaning if they go to the doctors a million times, stay in the hospital for 300 days, right? The most they would pay would be $4,000. This year, this year, you all, I'm seeing that up to $9,300. It's ridiculous. It is ridiculous. I don't know, and I'm just being transparent here. I do not know how our seniors are gonna make it. Let me carry on. Another thing that insurance companies are doing that is really affecting people like myself who help seniors day in and day out is that they are cutting commissions. They are cutting commissions. They are not paying us on certain plans, okay? Usually it's the plans that might have a lower out-of-pocket cost or something, right? Or that they find very expensive to insure beneficiaries. So what they do is to curtail enrollment is that they'll go and they won't pay independent agents or brokers like myself, the people on the ground who will answer your calls in the middle of the night. They'll do that because their thinking is if we don't pay them, they won't sell this plan, and then they won't have utilization of the plan, the beneficiary will. It's a dirty trick, but they are doing it, and it is really hurting people. Uh, and, there's even one company, in this type of business, right? And we carry a lot of liability in this business. And, today I'm speaking to you all the truth. I want y'all to put a prayer out there for me, but I just can't silent about this anymore. So one of the things that we get is residuals, right? And one company in Maryland in particular is no longer even paying us residuals for the clients that we did break up. Okay. So this right here, with over close to 45% of Medicare enrollees being helped by independent agent myself that they can call on the phone, that's their neighbor, right? Because a lot of us, we're not millionaires. We are your neighbors, right? The people who are, you know, working at your job with you, alongside you, and have to make a supplemental income to put our kids through college. That's who we are. We are not, in a glass building all day playing golf. We are your neighbors. We're your constituents. We are the person where you have a flat tire in a neighborhood and we see you and we're helping you change that tire. That's who we are. That's who I am. Okay. This is who this is hurting. And it's hurting our neighbors. So another thing that they do, like what they are doing to curtail enrollment, is that instead of taking applications electronically, these insurance companies are making it where you have to submit by paper. That's another thing that they're doing to curtail enrollment in these beneficial plans. I'm telling you all, it is an issue and it's really scary. Okay. So with that said, another thing that is being affected this year, okay, in a law that has come into play, right? And again, this is by the Biden administration. I am not political. I'm about seniors, but I do know that politics plays a part in it. And I just want to let you know who's who here, okay? There is something called VBAC, right? This is why you have those food cards. Let me know in the comments if you've ever had a food card or you've seen the commercials where you get money back in your check or money to pay your utilities, groceries, all the things, even PQ. Let me know in the comments if you've ever seen a commercial like that or if you maybe even have that benefit now. Right now, seeing the comments. I see them coming in, you all. Thank y'all so much for tuning in. You all, this is very important. Make sure you're sharing this information out. Again, I'm Melissa D. Hall. If you need any help at all here, just go ahead, reach out to me at thehallinsurancegroup.com. We have a contact us button. I'll be more than happy to help you with your Medicare plan. So, anyway, you're able to get those food cards and other things because they have something called the value-based insurance design, also called VBID. It's a Medicare Advantage model that allows plans to test innovative ways to provide benefits and structure cost sharing to encourage the use of high value healthcare services. Okay. And it ends this year. And it ends this year. So this this allows the companies to give the food cards and things. But what ended up happening, right, is that insurance companies started to use those instead of focusing on healthcare benefits. Those began to be used as bargaining chips to be in a plan, right? So if a person knew they could get $300 a month to cover their groceries, but they wouldn't be able to see their primary care doctor anymore, what do you think they chose? Right, it happened. Medicare became commoditized like car insurance. Like, I have literally called clients, and they'll tell me how much each carrier is paying. Okay, the whole premise for this got out of control. And on top of that, it costs the government a lot of money. CMS, the Center of Medicare and Medicaid Services, and I quote, said this. They called the model substantial and unmitigatable costs to the Medicare trust funds. They couldn't mitigate the costs. They were unmitigatable. Okay. They couldn't control it. It was costing them trillions. Okay. Trillions, trillions, trillions. So what's their solution, right? And actually, I apologize. It did not cost them trillions. The cost totaled over 2.3 billion a year from 2021 to 2022 and year over year. So it's billions of dollars. Still a lot of money for an already stressed system. So, in order to mitigate the cost, but they also realize that people do need these benefits, they switched. The government introduced something called the SSBCIs. Okay. That stands for the Special Supplemental Benefits for the Chronically Ill Program. Okay. This is what is to replace VBID. And basically, what it does is if you want to get one of those benefits, right, you had to prove that you had a chronic condition and that this would benefit your life, right? That this would benefit you. Meaning that if you enroll in a plan this year, or if you get into, we call them dual special needs plans, because those were the main ones that were offering these food cards and things, it's not just, oh, I'm automatically getting this card. No. With a lot of the plans, you have to prove that you have one of these conditions, okay? Or else you can't get it anymore. Or else you can't get it anymore because they're not being paid for it anymore. All right. Some of the um, conditions that they're considered chronic are diabetes, heart issues, not high blood pressure, but actual heart issues like coronary artery disease, uh, issues breathing like COPD. Each plan is different. So when it comes to a chronic plan that which are now like offering these food cards, right? They have to prove that they have one of these chronic conditions and they verify it by talking to your doctor. So when you apply for the plan, they will ask you, the agent will ask you, well, what is your doctor, your primary care or some new specialist? It depends on what company they decide to put you with. What doctor can verify that you have this condition? And you submit that information, and they'll try for 2 months. They'll give you a full 2 months, okay, to verify with the doctor that you do have this condition. Depending on how the card or benefit is attached to your plan, like let's say if you get a chronic illness plan that comes with one of these benefits, right? If they cannot verify that you're chronically ill, maybe your doctor doesn't respond, they can kick you out that plan after 2 months. Okay. Now, if you have a dual special needs plan, and a dual special needs, also called DSNP, it's for people who have both Medicare and Medicaid. Okay. And you have one of these benefits attached, you still have to prove it, okay? And if you don't prove it, if your doctor never responds, right? What they'll do, what I have seen for some of them, okay, not all of them, I want to make that disclosure, not all across the board, is that they will still let you be in the plan, but they'll actually go ahead and not give you the benefit anymore. And this is crucial because, again, when Enox came out September 30th, we're at the second, and not a lot of people know what's going on. And I'm gonna tell you this, there's a lot of people out here on Medicare who don't like to talk to nobody, anyone. They like to just set it and forget it. They've been in the same plan forever. But this is not the year to set it and forget it, okay? So, next up, you all. Are there any questions, you all? I know we went over a lot here, okay? We went over a lot. So let's talk about this. If you are looking for a Medicare plan this year, what should you be looking for? Number one, you want to make sure that your current plan, you want to see, is your current plan still going to be in operation? That's number one. Okay. Again, if you don't know how to get that information, just contact me. I'll help you. That's number one. Number two, you want to know if your current plan, if you have one, is changing the out of pocket cost. That's the second thing. Number three, you want to know about if your doctors will still be covered. All right. A lot of these doctors and hospital systems are fighting with these insurance companies because of payment, because of money. And they're no longer taking these insurance companies anymore. A lot of this, believe it or not, happens around the Medicare open enrollment season. So, I have clients all across the US calling me, "Is my doctor still gonna be taking this and her this?" So that's what you those three things you wanna make sure of, right? Then you wanna see, is there anything out there that you can get? Again, because the government is now on this whole SSCBI kick that they're funding, that's the new program. You're gonna see a lot of programs called chronic benefits, chronic plans come into areas that are going to be giving these benefits, food cards, and things like that. So you want to check and see if that's available in your area. But I will caution you this, okay? Let me caution you this. Because with everything, when you get something, something always gets taken away, right? Oh, I'm gonna actually give you a tip on something. With these chronic plans, you all, sometimes they may give you a food card, but then you might not have it, right? Or vice versa. So you really want to make sure you're looking at all the fine print and you're going line by line, right? You don't, and I understand that times are hard, food is high, everything like that. And I talk so much about the food card because really that is the number one benefit my clients ask me about. But you wanna make sure that your health in totality is being covered, alright? You wanna make sure of that. So, another question here, so excuse me, uh, what is this? Okay. So so what about United Healthcare dual plans? Will they stay the same? United Healthcare dual plans? Well, I'm not gonna speak on any company in particular because that's not compliant. But I will say you need to check your annual notice of change, or if you're a beneficiary, contact an agent like myself because all the plans are making changes. Do you hear me? All the plans, every company. I have not seen one company, okay, out of all the plans, all the hundreds of plans I have access to and represent, I have not seen one plan stay the same this year. Truly, I have not seen one plan stay the same. Out of all my hundreds of customers, okay, I have to talk to every one of them. It is no longer a set it and forget it type of thing. Okay. All right. So another thing that I wanted to add too that is also affecting benefits this year, the ancillary benefits like the dental and like the vision, was a law that was passed called the utilization law. And what does that mean? If you have a dental plan or a vision benefit from these Medicare Advantage plans, right? A lot of times these benefits were not getting used because people didn't know. Okay. They didn't know, they forgot about it, life went on. Well, starting this year, these insurance companies have to notify you quarterly of your benefits and how much you have left. Okay. So what do you think is going to happen, right? That maybe that $2,000 a year for dental or the $300 for the glasses or $100 for glasses, that's not going to sit there anymore because you're not going to forget anymore, right? So with that said, right? With that said, what do you think is going to happen? That raises what? The utilization, the cost. What do you think insurance companies are going to do? They're cutting back on those benefits because they know that. One thing I want to say is this, okay? Just to kind of educate you. Insurance is based on risk, which is mathematics. Okay? It is not based on politics. It's based on mathematics, it's based on mathematics, risk. Okay. Uh, if I insure this person, how much will they cost me? That's what it's all about. If I insure this person, how much will they cost me based on the studies of a person who has the same characteristics, the same diseases, lives in the same place, same age, same sex, right? And a bunch of other factors. It's all math. Based on those things, they're able to predict how much that person will cost. So when you throw politics into that, that is not mathematical, but more emotional. You have Medicare chaos. Can you all type chaos in the chat? You have Medicare chaos. A person asks, can you call me later? Yes, you can call me. You can call my office, 919-944-4515, 1-888-350-6855. Let me put that down. 1-888-350-6855. That is the number to my office. I have somebody there answering the phone 24 hours a day, okay? 7 days a week, okay? To help you, get you on my calendar, and I would be more than happy to help you. Okay? Call me 1-888-850-6855. I can help you. Okay? So, listen, y'all. Chaos. They put chaos. Mr. Allen put chaos in the chat. Who else? Come on, you all. This is chaos. Any more questions? All right. With that, y'all, I'm gonna switch gears here. Okay. I'm gonna switch gears. Yes, you all, who here has heard about the genocide of, of Christians in Nigeria? Let me know if you all have heard about that is going on. Most recently, uh, Bill Mayer, okay, the host Bill Mayer, he spoke about that on his show. And this was brought to my attention. And again, I've been seeing this, throughout the internet and things of that sort. But I had a subscriber uh, reach out to me on TikTok to cover this story. And I thought that it would be good, since you all are my viewers, to start covering stories that you all submit to me. All right. Uh, so Andre Allen said, I'm 59. Do I qualify for a dual plan? Hi, Mr. Allen. Let me just say this. I'm going to answer this question and we're going to get back to this story because I found out some incredible things about this genocide happening in Nigeria. So for a dual plan, dual special needs plan, that is a person who has Medicare and Medicaid. If you have both Medicare, that red, white, and blue card, okay, parts A and B. You have to have both parts, part A and B. And you have Medicaid, which is from the state, you could possibly qualify for a dual plan. Each dual plan different uh, has different qualifications to join. All right. So Bill Mayer, comedian Bill Mayer said this. He said, If your media sources are not talking about Nigeria, they suck. You're in a bubble. And I quote, I'm not a Christian, but they are systematically killing the Christians in Nigeria. They've killed over 100,000 since 2009, burned 18,000 churches. These are the Islamist Boko Haram. He said, this is so much more of a genocide attempt than what is going on with Gaza. They are literally attempting to wipe out the Christian population of an entire country. Wow. Wow, 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 wow. So, of course, we can investigate, like, is this true, right? Is this true? With the political and religious tension in this world right now, it didn't seem far off from being true. So, first off, I had to figure out, well, who is Boko Haram? Who here watching this remembers, I think it was in 2016, when over 200 Nigerian girls were captured from a school by Boko Haram. Who remembers them? Okay, that is the terrorist group. Alrighty. Now, let me tell you how they came to be. So basically, I'm just going to give you the rough and dirty of this. Okay, so they had a leader, they are Islamist group, and they really just they wanted an opportunity to live in Nigeria, right? They wanted more food, they wanted more resources, they wanted to go to school. And so they started this rogue operation. And really they terrorized everyone. Eventually they joined with ISIS, okay? And ISIS ended up they had a conflict because Boko Haram, uh, they don't just kill excuse me, they don't just kill Christians, they were killing everyone. They were literally killing everyone. They were blowing up mosques. They were getting kids to be soldiers and arming them. They were taking the young girls and raping them. Like, it's nuts. Okay, it's nuts. And so the Nigerian military, I mean, they were running scared. And a lot of their political officials, they were corrupt. Every time when they would try to kill one of their leaders, they would find out. So it wasn't much that they could do. And what Nigeria did, they teamed up with the country of Chad in order to try to overcome, right? And in some parts, they were successful. And right now, it is a big conflict in Nigeria about this because they started a rehabilitation uh, program for people who were in Boko Haram, okay, giving them food, giving them lodging, giving them an opportunity to study, okay, and get an education while the rest of the people who they've harmed, right, their victims, are drinking dirty water. So there's a lot of conflict about that. I did go ahead. I did my research. I read Al Jazeera News. Okay, Gimba Kakonda. He on there. He has a really good article about this in True Crime by Rennie, who's actually based in Nigeria. Her YouTube, check her out. And basically, from my research, you all, from what they're saying, and there's no genocide happening in Nigeria. There's no genocide happening in Nigeria against Christians. These terrorists, Boko Haram, they kill Islamists, they kill Muslims, and they kill Christians. And from my research, what they are doing is that anybody who is killed, they're just labeling them as a Christian. And this is all stemming, according to Al Jazeera News, this is all stemming because Nigeria demanded a higher status with the United Nations. They demanded that they be able to have weapon support, humanitarian support, and they were denied. And basically, they are calling this propaganda being spread by the West in retaliation for them demanding access to resources. That is the news. That is from my investigation. Implore you all to go to the sites that I have cited here. Again, Al Jazeera News, they have a really good article on this and true crime. One thing I can say with a lot of terrorist groups and things of that sort, they're usually self-serving and all turn on themselves. So to me, this isn't hard to believe. What do you all think? Have you all found any evidence refuting what I'm saying? If so, I would like to know. And if you have a story that you would like me to cover on our next episode, just go ahead and submit it to info@melissadhall.com and I will get to the bottom of it. Next week, you all, we have a very, very special episode. Okay. So excited about this. And just to let you all know, for those of you all who are new here, okay, I stream every Thursday at 5:30. And so the topic next week, you all, is why good men end up divorced. That is what we're going to talk about. And I have love expert Leslie. She's actually a relationship therapist. Okay, so she's actually a real therapist and she focuses on men, alrighty, and helping successful men have successful marriages through her through her practice, the Husband Hero Project. And if you all did not know, more than 80% of divorces are initiated by the women. And she tries to help men stay married. And she's going to talk about that. And if you are going through a divorce, you could learn how to stop it. All right, Miss Nikki says, thank you kindly for sharing the information. You're welcome. Listen, I'm so happy you all got this information. I want to see y'all next week. Share this is going to be a great episode on how to stop divorce and why good men end up divorced. Some of the things that she said was uh, having a sexless marriage was a big reason for it. Poor communication, right? Of being emotionally unavailable, and some other things that we are going to dig into. And if you all have a question that you all would like me to ask Miss Leslie, please let me know. And I'll just leave you with this last thing because, again, working with seniors in my day job, a lot of people, I would say about 20% of the people coming to me who are turning 65 are getting divorced. Yes. Over 50% of the population in the United States gets divorced, right? 50% of marriages end up in divorce. And we are going to dig into that from the male perspective, y'all. So if you're a man out there, we're going to help you stay married, right? And if you're looking for love, we want to help you stay in love. All right. So I'm very, very excited. All right. Teresa Gay said, thank you. I'm going to call you soon. You are so welcome, y'all. Make sure y'all tell a friend to tell a friend to tell a friend. Get well with Mel. Okay. I'm so happy you all showed up. And listen, you want to follow my journey. I'm on a 90-day journey until I become a nationwide talk show host. And today is day 49. Do you all think I'm going to make it? I do. Wish me luck. I post updates every day about it on my social media, on my Instagram. Every day I post a video on what's happening. Y'all have a blessed day. Thank you.